Hello, good morning, good afternoon, good evening to wherever you are joining us from around the world. It is great to have you all signing in and saying hello in the chat for today's Biogal webinar, Canine Vaccinations from Puppies to Senior Dogs, presented by Dr. Paola Dall'Ara. It's wonderful to see everyone joining in. Hello, I can see people joining from Turkey, from Mexico. It's great to have you all. It's important for me to let you all know that there is live translation available for today's webinar. There is Portuguese, Turkish, and Spanish live translation. If you have a look in your Zoom menu on the bottom or the side of your screen, you will see an interpretation button. If you click that, you will be able to select your language of choice and you can have live translation of today's presentation. We will be having a question and answer section after the presentation. If you would like your question to be presented to Dr. Paola Dall'Ara, please make sure that you put it into the Q&A box. Again, if you have a look in your Zoom menu, you will see there is a Q&A button that you can click. If you make sure to put your question into that section, then it will be correctly recorded and we can make sure to present it to Dr. Dall'Ara. Don't worry if your question is not answered live today. It will be recorded and given to Dr. Dall'Ara afterwards. She will go through all of the questions and answer them, and these will be sent along with the recording of today's webinar. So please make sure to put your questions there because that will make sure that they are correctly recorded and that we can pass them on to Dr. Dall'Ara. My name is Jessica Case. I am the manager of Complete Veterinary Care, and we are very proud to be the UK distributors for Biogal. If any of our listeners are from the UK, you can get in touch with us at info@cvcgroup.co.uk with any questions about Biogal's products here in the United Kingdom. For everyone else, please get in touch with Biogal. On their website, biogal.com, you can contact them there. Our speaker today is Dr. Paola Dall'Ara. Dr. Paola Dall'Ara is a tenured associate professor in the Department of Veterinary Medicine and Animal Sciences at the University of Milan. Her main field of study is in applied immunology and pet vaccinations. Dr. Dall'Ara is the author of the immunology section of the 3rd edition of the textbook Veterinary Microbiology and Immunology, and the book Vaccines and Vaccinations of Companion Animals, as well as over 200 scientific and popular papers and articles. She has contributed to over 110 congresses, had over 100 invitations as a speaker for lectures, and has tutored over 330 degrees in veterinary medicine. It's a great honor to have her speaking to us today. At the end of Dr. Paola's presentation, there will be a short video clip with Dr. Marco Giosso, who will be introducing an exciting new initiative that Biogal are starting to help vet professionals to better run the business side of your practices. So please stay tuned to learn more about that new project. One more reminder that there is live translation for Portuguese, Spanish, and Turkish, and to please make sure that you record all of your questions in the Q&A box rather than the chat. It is a great honor to hand over to Dr. Paola Dall'Ara. We look forward to hearing from you. Thank you, Dr. Paola.
Thank you, Jessica, for this beautiful presentation. Thank you, Biogal, for this invitation, and good morning, afternoon, and evening to all of you. This is a big emotion for me, and I beg your pardon for my English and not a fluent English, but I promise I will do my best to speak in a correct and comprehensible English. So we can start with my presentation. Okay. But before starting, I want to present myself. I don't know if I had shared also the audio, but this is me. I hope so. And now we can start talking about the argument of today, tricks and hoaxes of canine vaccination. Last year, I presented for Biogal an analog presentation about feline vaccination. But this year, we decided to speak about this very important field. In order to vaccinate and well vaccinate both puppies and adults and elderly dogs, we have to start off on the right foot. And for this, we have to consider some important variables. First of all, the owner, then the dog, then the vaccines, and last, the vaccination. So we start with the owner. The owner is very, very important. And we have to always remember that both owners and breeders want to get involved with the vet and want to establish an empathic relationship with the vet. So how vets have to communicate with owners? This is a very important thing. Vets have to provide a complete, updated, and above all, scientifically correct information. Times and content must be every time adapted to the owner's cognitive and emotional needs, because not all the owners are all the same. And communication must be coherent and structured in order to correctly orient the owner decision. Why I put these two characters of the movie Madagascar?
I like to move it, move it. I like to move it, move it. You like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it.
Because also the posture and the body language are very important. When you are speaking with your clients, with the owner, you have to look into the eyes, the owners. You have to avoid using mobile, for example, or PC, because owners need attention, and you have to guarantee a complete and sincere information. For example, you have to avoid, minimize adverse reaction, for example. This is very, very important. For the ratio with the owner, the important association, international association, the same who prepare the guidelines for vaccination for vets, prepare also, decided to publish also similar but simplified guidelines for owners and breeders. In this slide, I put the main guidelines that you can find in internet. For example, the PSAVA, the AHA, and so on. In this slide, you have an example of the guidelines dedicated to the owners. This is the AHA guidelines for owners with the top 10 things you need to know about these guidelines. The AHA present also Clark. Clark is the mascot of the AHA guidelines, and these guidelines are very recent because are the 2022. And this is a good help for you in order to communicate in a good way with the owner and the breeders. Another very important aspect is the dog. And dogs are not all the same because they differ for age, for example, sex, size, lifestyle, work, and the international and share recommendation is that vaccination must be tailored for each single dog based on these all characteristics, and not the vaccination must not be all the same for all dogs. For example, in 2019, the AHA presented the canine life stage guidelines that divide the age of the dog in 4 categories: puppy, young adult, mature adult, and senior. And this is very important because the age is different, and also needs are different based on these different age. For example, these two are Ginny and Penny, my 2 dogs, when they were puppy. Then they grow, so they are young adult. Now they are between young adult and mature adult. So these are Ginny and Penny now, and this is Linus, and another companion of our life. Very important and very useful in the communication with the owner is this table that relate the dog age with the human age. And this permits you to communicate with owners that can understand how old is their dogs. And very important, not all dogs grow in the same with the same speed. And this is very important also for vaccination. But starting with puppies, we know that in puppies, like in the kittens, immunity doesn't work very well. Till 30% of live-born pets die before reaching 3 weeks of age, and 70% of these die in the first week after birth, in many cases for septicemia. This was Marta, my old dog, just born. Puppies have a not complete immune system and can fail to mount an effective immune response when they encounter for the first time a new antigen. And in this case, they mount the so-called primary immune response. In this type of response, the antibodies are slow to appear, the antibody titer are low, and the important DOI, that is duration of immunity, is limited. And if the immune system doesn't encounter in a quick time the same antigen, this response sometimes totally disappear. But in the meantime, many memory cells are produced, and these cells are the key for a successful response when the immune system encounter for the second time, the third time, and so on, the same antigen it encountered the first time. In this second response, the name is secondary or anamnestic immune response, the response is much faster, and the antibody titer are much higher, and the DOI is much longer. And that means that the protection lasts months or in many cases some years. So if we consider the motto of the Olympic game, the objectives are the same, because the secondary immune response is faster, higher, and stronger. We know that in carnivore, the placentation is an endothelial placentation. And this is a sort of barrier, impenetrable barrier, to the in utero antibody transfer. In fact, only a little amount of IgG can pass through this barrier till the puppies. So at the after the in the first day of their life, puppies have a very low systemic immunity. So the main transfer of a passive immunity is postpartum via colostrum, but there is a great variability in colossal immune quality. In fact, this is among bitches, but also among, for example, the mammary glands of the same bitch. The colostrum surely is fundamental for the puppy's survival, because in colostrum there are many nutrients and there are many antibodies. And these antibodies are called maternally derived antibodies, the MDA. But the MDA, so important, is considered a double-agent weapon. In fact, they help in reducing neonatal mortality and in increasing puppy survival rate. But on the other hand, they can interfere with puppy vaccination. And this interference is really variable and depending on many, many factors. But this interference can cause the so-called vaccine failure. You have always consider this interference, because This is responsible in many cases of this dangerous vaccine failure. But how many MDA pass to newborns? How long MDA lasts? And how long MDA interfere with vaccination? These are very important questions, but the answer is not so easy. In fact, all depend on antibody half-life in offspring. The antibody half-life is in how many days the quantity of these antibodies begin the half, and this depends on many factors. For example, what is the antibody titer of the mother? So how many antibody has the mother? How many antibodies are present in the colostrum? How many colostrum is intake from puppies? How many colostral antibodies are absorbed into the gut? And also, this is a very important factor, the MDA specificity, and this depends on the pathogen. In this table, you can see that, for example, antibodies against distemper or against infection canine hepatitis have a half-life of 80.4 days. That means that every 8.4 days, their quantity begin the half. The antibody against parvovirus have a half-life longer, more or less 10 days. The consequence is that the protection duration for distemper and hepatitis is more or less 9 to 12 weeks. The protection against parvovirus infection is longer, but not only the protection is longer, but also the interference with a vaccination is longer. So around 6 to 8 to 10 to 12 weeks, so there is no a precise moment, MDA begin to decline, but very slowly. In this moment, puppies lose protection and they are considered immunocompetent, and MDA interfere less with the development of an active and adequate immune response. So the guidelines, what is the suggestion of the guidelines? To start vaccination of puppies and also for kitten in this moment, always considering this MDA interference. Another factor very important for the success of vaccination is an individual response, a genetic difference, because MDA drop depends also on genetics. In fact, there are some animals defined non-responder. The non-responder are puppies, but also adult dogs with an immune system genetically and congenitally unable to recognize some antigen. And this antigen can be field antigen or vaccine antigen. Generally, only one every time, not much more than one. And these animals are not immunosuppressed, but they can't mount an adequate immune response against one antigen for all the life. The other situation, a little bit better, is the low responder or poor responder, that are animals able of producing only low antibody titer, but insufficient for protection. And this is not a good condition. The better is the slow responder one, because in this case, animal take longer than a normal subject to activate the immune response, and then they can mount a correct immune response, but with some days more than a normal dog. And in some cases, they need another stimulus, for example, another shot of vaccination. And there are breeds with a high prevalence of no responder or low responder dogs. And they are especially Rottweiler and Doberman Pinscher. And also the number of no responder dog is particularly higher in defense of parvovirus infection. In fact, 1 in 1,000 dog can be a no responder dog. Another problem is with rabies, because in the case when in order to move a dog from a country outside the country, in some cases, apart vaccination, some countries requires also the antibody titration. And if the protective titer is not okay, these dogs can't move outside the country. So this can be a big problem for an owner. The small breeds, on the contrary, are in some cases high responders, so it's more easier for these breeds to mount a correct protection against this pathogen. Very important is also the breed and the size. Why? Because this can interfere with the MDA half-life. In fact, there is an inverse relationship between growth rate and MDA duration. In particular, the puppies of large or giant breeds that are fast-growing breeds lose MDA protection earlier than puppies of small or medium breeds. So in this case, you have to consider not to treat in the same way large puppies or small puppies. So it is advisable not to wait for large puppies and start vaccination, for example, at 6 or 7 weeks of age, instead of wait to the 8 weeks of age, that is the classical age of for the beginning of the first vaccination series in the puppies. Also, sex can be important considering vaccination. For example, one classical question is, does a pregnant bitch need to be vaccinated in order to mount a good response and have a good antibody amount to pass to the offspring? In my opinion, vaccination of a pregnant female would be avoided. You have all the life of the bitch, and you can avoid to vaccinate the bitch in this particular and delicate moment in order to avoid potential risk for fetuses. But there are some situations when it's not possible to wait. For example, it can be an outbreak, a parvovirus outbreak, or the owner need to move abroad the dog, in this case, the bitch. In this case, you have to use only vaccines registered for pregnancy. So you have to carefully read the vaccine leaflet, because in the leaflet, there is the specification if you can use the vaccine during pregnancy or not. There is an exception, and this exception is the herpes vaccine, because in this case, and only in this case, this vaccine is registered for this period, because you have to use before conception and during the pregnancy in order to mount an active response and to have a good quantity of antibodies that bitch can pass to the offspring via colostrum. For example, in Italy, for cats and for queens, there are no vaccine registered for pregnant queens. I don't know in other countries, but in Italy there is this problem, apart rabies, because most of the vaccine against rabies are registered for this period, but for other important diseases, no. Speaking about vaccines, we know that vaccines are registered all over the world, and if a company want to prepare and put on the market a vaccine, need the authorization, the official authorization in Europe by EMA, European Medicine Agency, and in the USA by FDA. And if this organization give a positive opinion, they release the marketing authorization for this particular vaccine. For one of the most important documents of this registration authorization is the summary of product characteristics. This is an official document that need to for the registration, and in this document there are all the information related to this vaccine, and this is updated throughout the life cycle of the vaccine. This is a public document and is ready to download, for example, for the EMA website. This is an example of the SPC for a vaccine, and this is more or less the same for all drugs. In this document, in the SPC, this organization used two different verbs that are to prevent and to reduce. For example, for a vaccine, you can read that this vaccine prevents mortality. That means that of vaccinated animals, none shows mortality, none dies, compared to the control group unvaccinated. But you can read that a vaccine reduces mortality. In this case, of vaccinated animals, many, but not all, don't die in comparison with the control group. So if you have to compare two vaccines, two different vaccines, you can control how many times there is present the verb to prevent, and how many times is present the verb to reduce, because prevent is better than reduce. Vaccines are not all the same, because there are two big categories of vaccines: the non-infectious vaccines, that are vaccines that, when administered to an animal, don't replicate. And this is the case of the killed or inactivated vaccines, or the subunit vaccine prepared synthetically or via recombinant way. And these vaccines represent exogenous antigen because they don't replicate, they remain outside the cells and stimulate especially an humoral immunity, so the production of antibodies. The other categories is the infectious vaccines. These vaccines, when administered, they replicate in the organism. And this is the case of the modified live vaccines, the MLV, and the vectored vaccines. These represent endogenous antigen because, for example, viruses enter into a cell and the cell became the antigen present in cell. In this case, they can stimulate not only an humoral immunity, but also the cell-mediated immunity. So a complete response. This is hard to understand, but this is the same dog. This is always Penny. And not all vaccines are for all animals. In fact, all the international guidelines agree in dividing vaccines in categories. So there are the core vaccine that are the recommended one for contagious, widespread, and life-threatening diseases. There are the non-core vaccines, the optional one, recommended only in case of real risk of exposure for this particular animal, based on the lifestyle and the epidemiological situation. There is also another important category, that is the circumstantial vaccines. In this case, these are vaccines that from the non-core category move to core one for the real risk. For example, in Italy, example of circumstantial vaccines are the rabies vaccines for dogs and cats, the leptospirosis for dogs, and the leukemia virus for cats. These are non-core vaccines that became core vaccine for the importance of these diseases in Italy. And there is also the last categories, or the non-recommended vaccines, for which there is a little evidence of benefits. In this slide, we have all the vaccines for dogs and for cats, but today the importance is for dogs, divided into the 4 categories. So the core vaccines are the classical trivalent vaccination, parvovirus, distemper, infectious hepatitis. The circumstantial are rabies and leptospirosis. The non-core are all the other, apart coronavirus infection that is considered not recommended for the little evidence of benefits. The dogs are not all the same also for their lifestyle and for the work they do. And, for example, leptospirosis is a very important disease. And why leptospirosis vaccines consider so important, like a core vaccine? Has leptospirosis changed over the years? oh yeah, this disease changes with a big changement. For example, for the climate changes, and these climate changes with a lot of humidity or flooding help Leptospira diffusion and survival. Also, the reservoir hosts have urbanized, for example, rats, mice, and many, many others. And owners take their dogs everywhere with them. And all these are a factor that have changed this classical disease. In 2023, the ACVIM published the update consensus statement on leptospirosis. And in this official document, they underline that leptospirosis continue to represent an important disease, include for all dogs, including small breed dogs, also from urban areas. So it's very important to vaccinate all dogs because all dogs are at risk of leptospirosis. This is why the vaccination against this disease is considered like a core vaccination. Are all lepto vaccine protective? No, and this is a big problem because the cross protection between different serovar of leptospira of different serogroup is very limited or null. So in the ACME consensus statement, they suggest they underline that the cross protection is not so good, and this vaccine, the name, they are called bacterins. This is the vaccine against leptospira, elicit a serogroup specific immunity. So if you vaccinate against only 2 serovar with the classical L2 vaccine, you have no the guarantee of protection against other serovar. So you have to use vaccines with the highest number of different serogroup. And on the market, there are L4 vaccine in Europe or L5 vaccine in USA. This is a particular situation because for about 10 years, I repeatedly received mails from vets asking me if the Australian Shepherd dogs can be vaccinated against leptospirosis with the recommended L4 vaccines. Why this question? Because some breeders are opposite because of the presumed danger of these vaccines, the L4 vaccine, in the Australian Shepherd, linked to the mutation of the gene MDR1. And the same breeder suggests to use L2 vaccines in this breed instead of L4. But this is the truth or a hoax? I began my research and I began to search in internet, visiting different websites. And for example, in the website of the Australian Shepherd Health and Genetics Institute, the best place to look for, in my opinion, not only there is nothing about this fear correlation, but in this website, they suggest to vaccinate dogs following the AHA guidelines. They recommend vaccination based on the epidemiological risks. So the AHA guidelines suggest to vaccinate dogs with L4 vaccines. Another example, the Coxwell Animal Clinic in the USA have a page dedicated to this mutation. And in this page, they state the vaccine do not cause any reaction relating to this mutation. But they suggest to avoid other drugs, for example, ivermectin in dogs with this mutation, but not the vaccines. In another example is the Cornell University. They are a similar pages dedicated to this mutation, but there is no mention for the danger of the vaccines. So if I had time, I could go on with other reassuring example, and I can reassure you that you can use L4 vaccine in the Australian Shepherd dogs as well in all the other dogs, large or small one. And consider that some breeders, I don't know in your countries, but in Italy, sure, some breeders of small dogs advise their client against the use of L4 vaccine because they consider this vaccine too heavy for these small dogs and suggest L2 instead of L4. This represents a big danger for these breeds, because with the L2 vaccine you have no guarantee of protection. We can start now with the last factor, the vaccination. But what vaccination is? This is my preferred definition of vaccination. Vaccination is a trick to mislead the immune system, making it believe it has to fight an infection. And the more the vaccine will be similar to the true offender and will activate the immune defenses like the field pathogen, the more the trick will work. So if you remember the two categories of vaccines, the non-infectious and the infectious one, the non-infectious vaccines can stimulate only a non-complete immune response, and generally they need annual booster. The infectious vaccine, on the contrary, can stimulate a complete immune response. And after the first vaccination series, the protection is much longer than 1 year. So if you remember the trick, we can say that the non-infectious vaccine are the trick that don't work so much. On the contrary, the infectious vaccines represent a perfect trick for the immune system. So you have to choose the best vaccines, the best vaccination for each patient and each situation. Never again by habit all the same, because all dogs are different and are not the same. And you have every time, you have to consider the real risk for that patient, the lifestyle, the particular individual feature, for example, the size, the age. So if you have to vaccinate a puppy, you have to do something, but if you have vaccinate adult or senior or geriatric dogs, probably you have to do other things. You have to consider the health status, the type of vaccines, and the possible side effect. And you can use a little help from the veterinary guidelines, because these guidelines are many today, and these help veterinarians in choosing the best vaccination protocol and the best vaccines for each patient. These are examples of many different guidelines, and all these agree with the same points, so we can't find different opinion. You have always to remember that in puppies there are MDA, the maternally derived antibodies. These antibodies protect puppies in the first weeks of life. So ideally, the first vaccination could be administered when MDA are about to wane. But this prediction is very difficult because some puppies can have poor MDA, and they are vulnerable and able to respond to vaccination and at earlier age. For example, the large puppies, puppies with the large size. But puppies with high MDA may be protected and so also unable to respond to vaccination until 12 weeks of age or even more. So every puppy is different from another, and every puppy has its own history, and you have to consider this in order to correctly vaccinate puppies. So when you can start with core vaccines, there is no a primary vaccination policy perfect with for all puppies, will cover all possible situations. So the guidelines suggest to do multiple core vaccines shots using MLV vaccines, so live vaccines, starting from 6 to 8 weeks of age, and repeat vaccination every 3 or 4 weeks until 6 weeks of age or older. This is very important. You can start, for example, at 8 weeks of age. This is a classical beginning for vaccination of the puppies with a trivalent vaccination, and repeat vaccination every 3 or 4 weeks until 6 weeks of age or more. So you have to follow the suggestion of the community to do at least 3 vaccination. Never stop before, because stopping at, for example, 12 weeks of age, and so do only 2 vaccination, is considered the main cause of vaccine failure. These multiple vaccination are revaccination, because you are using MLV vaccine, live vaccine, and live vaccine recall themselves, boost themselves. Also, only in case of emergency, it is possible to anticipate the start of vaccination to 4 weeks of age, but never start before. If not, the adverse reaction of vaccination is will be your main problem. If you have to vaccinate an adult dog, if you use core vaccine, you can use only 1 shot, because you are using live vaccine, and live vaccine booster themselves. If you have to use other vaccine, you can use only one shot if these vaccination are the booster vaccination. But if you begin vaccination for the first time in an adult phase of the dog, you have to use 2 shots and not only one. The exception, like the other time, is the rabies vaccine, because if you have to vaccinate a dog in a rabies-free countries, you use only one shot. On the contrary, if the vaccination is a vaccination in an endemic country, you have to use 2 shots. Very interesting is this paper, is my paper, about the effect of aging on the immune response to core vaccines in senior and geriatric dogs. This is a paper of the last year with my colleagues. And in this paper, we consider the aging of dogs and the dogs, consider the senior and the geriatric dogs, considering that longevity is inversely related to size. And that means that large dogs age faster than small one, and you have to consider dogs in need of elderly care at different time depending on the size. Because if you have a giant or large breed, they became elderly from 5 to 9 years. But if you consider the small one, they became elderly from 9 to 13 or more years. For example, this was my dog Maggie, 25 kilos of weight, and she has 16 and a half years. That means about 100 years in human age. And during the aging, both cell-mediated and humoral immunity are weakened, and in particular the cell-mediated immunity. And this is very important in order to understand the response, for example, to vaccination. And an important thing is that as age advances, the secondary immune response, that is the response against something new, continue to work well also during the aging, also in an elderly patient. On the contrary, the ability to mount a primary immune response against something new, some new antigen, it can be very difficult and declines significantly with age. So this means that the elderly patient has a dangerous increased susceptibility to infectious diseases caused by something new. And this can limit the effectiveness of vaccination in the older individual. But in our study, we can demonstrate a very interesting effect, because we study the response to the 3 core vaccination, parvovirus, distemper, and hepatitis, in senior and geriatric dogs, using in an in-practice test kit that is VacciCheck, produced by Biogal. And we can demonstrate that the protective antibody titers remain high in many dogs against, above all, parvovirus and adenovirus of canine hepatitis, a little bit less for distemper virus. But there is an important difference between senior and geriatric dogs. In fact, protection is higher in senior dogs than in geriatric dogs for all the three diseases. This is very important because, first of all, you can consider in the same way a senior dog and the older dog, a geriatric dog. This is the first thing. The other thing is that you have to monitor, you have to control this patient, and controlling protection in aging dogs is the best thing you can do in order to avoid to lose protection. And given the known difficulty of an elderly individual to mount an immune response and a correct immune response toward a new antigen, the trick to try to ensure vaccine protection is control protection in order to avoid to lose protection. And it is possible to continue vaccination in elderly stages, and you have to explain this rationale to owners, because some owners feel that their dogs are too old for vaccination. On the contrary, they need vaccination, above all if they are geriatric patient and not only senior patient. Another interesting paper of last year for me was the year of control protection in different patients. In this case, we study the possible negative effect of chemotherapy on protection against core vaccines, in this time in canine cancer patients. And the journal that was the Veterinary Science decided to dedicate the cover of the issue of April to our study. And this is Marta. Marta was the sister of Maggie, my 15 years old dog that died for a transitional cell carcinoma of the bladder. And in our study, we can demonstrate that, contrary of the common thing, the chemotherapy doesn't negatively affect the protection against core vaccination, because this is guaranteed by the secondary immune response. The secondary immune response continue to work also in oncologic patient that were treated with chemotherapy. So, contrary to expectation, chemotherapy does not have a marked immunosuppressive effect on the post-vaccine antibody response. It is a very good news, above all for the owners and not only for the vet. So it is possible to control protection, and this is not only possible, but in many cases, this is essential for the good vaccination practice. But this is possible only for core vaccines, for dogs and for cats. And for this purpose, you can use the gold standard method, for example, the virus neutralization or the hemagglutination inhibition. But in this case, these methods can be long, for example, expensive, and you have to wait the response of the laboratory. But you can also use the in-clinic test. And now on the market, there are many lateral flow tests, disposable only for dogs for now. And there is only one ELISA test, that is VacciCheck, for both dogs and cats. And also the international guidelines suggest to use the in-clinic test, not a particular VacciCheck, but generally the in-clinic test, in order to control protection in many different situations. And I had started before the SAVA guidelines controlling protection and antibody titers in dogs from 2014 and in cats some years later. And to date, I tested really many pets, more than 1,000 dogs and more than 700 cats. And I can publish last year two complete work about this particular aspect of immunology that is a very practical aspect. So I can demonstrate that in dogs, the response to core vaccine it is a long response, lasts many years, and revaccination on a 3-year basis can be recommended for the core vaccine by using MLV vaccines. For cats, this is the last article I published in November. I do the same study on a total of 740 cats. And in this case, most cats maintains high protective antibody titer for 3 years or longer after vaccination against parvovirus of Paleocopenia and calicivirus, but not for herpes virus. So, since not all cats were protected after so many years and for all pathogen, check protection by antibody titration could be the choice, could be the standard care for cats in order to prevent immunity breakdowns, because these could be very dangerous.
Hello, dear veterinarian, dear colleague, dear staff member of a veterinary practice. I and Biogal are here to help you more in practice or in your management, in your veterinarian administration. My name is Marco Gioso. I am a veterinarian as well as a dentist. I am board certified for the American Veterinary Dental College in the United States. I was graduated in Brazil as a veterinarian and as a dentist, where I taught surgery, dentistry, and management, entrepreneurship, which means I help veterinarians to know better their numbers. Probably if you're a veterinarian, a typical veterinarian, especially a senior vet, you don't know some numbers, some KPIs, key performance indicators, which is numbers. the BI, business intelligence. We as veterinarians are very good in CI, clinical intelligence, our numbers. The ratio of all enzymes in the body, all blood cells and everything, dealing with diagnostic and treatment. However, we have a lot of difficulty in understanding our numbers, such as how much can I pay for veterinarians, for staff members, how much can I pay for a rent in a building, how much can I pay for the vaccines in good practice, what is the best profit, what is the revenue I should have according to the city I am, country I am, according to number of employees I have. All these numbers are very hard to know because we didn't have that in the vet school. So learning that, I started to teach veterinarians, besides surgery and dentistry, also these numbers. Probably most of the veterinarians who are here now do not know these kind of numbers. So I and Biogal are going to be here during these lives, during all year long, bringing you some news on numbers, on leadership, on management, on financial numbers of a veterinary clinic. You are gonna like it. Besides the CI clinical intelligence with the great webinars we are going to have here during the whole year, you are also going to have some hints, some information on these kind of numbers. You can even email us and ask for some kinds of information or some questions. No problem, we're going to be here to help you. My name is Marco Gioso. It's a pleasure to be here with you. Thanks for the honor to be here. You are going to be with us, Biogal and Marco Gioso, here for the whole year. I hope we can help you a lot. Brazilian hugs to all of you, and I hope to see you next time. Stay tuned with us. Bye.
Thank you very much, Dr. Dall'Ara. That was a really informative, really great webinar. I can see that we've had lots of great feedback on the chat.
I can't see you, Jessica.
It should be loading, but I will get started with the questions so long. Oh, there we go. It should be popping up. I'll get started with some of the questions that we've had come in, as long as you can hear me. So okay. One of the questions that we've had come in is testing antibodies in puppies a reliable way to decide when to begin vaccinations for clients who want a more individualized vaccine protocol?
Yes, this is possible. I do this in some puppies before starting vaccination, because the test in particular, I know very well VacCheck. This test can be used also in puppies in order to measure MDA, maternally derived antibodies, and you can do a simple sample of blood, and you use this for measure the quantity of antibodies in this moment. For example, close to 6 weeks of age or 8 weeks of age, in the moment when generally you begin vaccination. But you can control if in this moment there are again many antibodies, for example for parvovirus, that represent the main problem, and if these antibodies are present, you can vaccinate in this moment. So you have to delay vaccination. You don't need to do another sampling because you know the half-life of the antibodies against parvovirus. I do an example. If at 8 weeks of age you do a sampling, and you measure antibody against parvovirus 1 to 160, that is more than the cutoff, that is 1 to 80 is the cutoff, and this is the protective antibody titer. If a puppy has 1 to 80 is protect against parvo. If the titer is the half, 1 to 40, and the puppies encounter the parvovirus, the response is not so good. If the titer is the half, 1 to 20, this puppy has no defenses against parvo, but you can vaccinate this puppy successfully. If you do a sampling and this puppy has a titer 1 to 160, this puppy has many antibodies against parvo. So you can't vaccinate this puppy now. You know that the half-life is 10 days. So in 10 days, after 10 days, the quantity will begin the half. So 1 to 80. 1 to 80 is too much for a successful vaccination. So you have to wait, and you can wait 10 days more. After 10 days, the quantity will begin the half, so 1 to 40. In this case, you have the sampling now, and you can vaccinate after 21 days, so after 3 weeks. This is an essential information you can have with only one little sample in one moment before vaccinating.
Great, thank you so much. That's a great answer. Another question that we've had come in: if a bitch has never been vaccinated and becomes pregnant, would it be advisable to vaccinate towards the end of the pregnancy to allow her to make antibodies, which can then be transferred to the puppies with the colostrum?
Okay, but the problem can be you can use vaccines during pregnancy because you have to control if vaccines are allowed during pregnancy. If yes, you have to consider that in many cases you use live vaccines, but during pregnancy, in some cases, you have to use killed vaccines. So you have to control in the vaccine you use after how many days the immunity begins to work. So probably this response need 15-20 days in order to begin. So if you decide to vaccinate at the end of the pregnancy, probably this is too late because these antibodies are not ready to and are not disposable to pass into the colostrum. So probably it's better to anticipate vaccination during pregnancy with a right vaccine, but probably at the beginning or at the middle of the pregnancy, but not at the end of the pregnancy.
Okay, thank you. The third question we've had: considering the increasing interest in minimizing unnecessary vaccinations, how do you integrate titer testing into your overall vaccination plan? are there specific conditions or situations where titer testing becomes particularly valuable in tailoring vaccination plans for individual dogs?
In many different situations, because antibody titration represent a good help for you for many different situations in order to decide if continue vaccination or not in an adult dogs or cats, for example, because in many cases the protection lasts for many years, so you can control and you can avoid an useless vaccination. For example, you can have, for example, the other example, when to start vaccination. You can control before vaccinated, before vaccination, but you can also control after vaccination if vaccination worked. For example, in the breed that you know there would be a problem, for example, Rottweiler or Doberman, when the presence of non-responder dogs is a problem, or when you have an allergic dog, and in this case you can control if this dog needs vaccination or not, or in an elderly dog, or in a dog with a mute history of vaccination. You don't know nothing about this, but you don't know if this dog had an owner in the past, and if this dog was vaccinated or not, and you can control vaccination before do a possible useless booster. There are really many different situations when you can use this kind of in-clinic test. Very, very useful.
Yeah, it's very multi-use. It's great that there's so many uses for it. We've had a few questions about different brands of vaccinations. One was in revaccinations, for example, for cold vaccines, can we use different brands for the second or third doses? Another was, does the vaccine brand make a difference? Are there any studies on the difference in percentages of low or non-responders according to vaccine brands?
No, generally you can use different vaccine of different brands without problem, because you can start with a vaccine for parvovirus and continue with another vaccine, and there is a very good cross-reactivity between different vaccines. The only situation when you have to pay attention is for leptospirosis, because for leptospirosis you can use you have L2 vaccine, L3, L4, and sometimes L5 vaccine. So if you begin a vaccination with an L4 vaccine, you have to continue with another L4 vaccine, perhaps of another brand, but you have to consider that they must be the same type of vaccines. And this is not the rule.
Isso não é o caso.
Okay.
Ok.
Okay.
That's great. Yeah, thank you so much.
Muito obrigada, doutora Paula.
Translators coming across.
The translator in Portuguese.
Eu estou aqui.
Oh, there we go, popping up again. Okay, so I think with that, we have run out of time. That was really, really interesting. Thank you so much for your presentation. I can see we've had lots of people thanking you in the chat from all over. It was very, very interesting and really helpful. So thank you so much for your time and for your expertise. We really appreciate it. Thank you
I
to
thank
Biogal.
you. If I can, I want to thank you, Biogal, for this invitation. It's very precious for me and for all vets. I promise that when Biogal will send me your question, I promise to answer to all questions. I need time, sure, but I promise I do this this for you.
Fantastic.
Thank you.
So
Thank you very much.
yes, we will be sending those questions over to Dr. Dall'Ara. She will answer all of them as she's promised, so we can hold her to that. And you will be sent those questions along with the recording of today's webinar. So thank you, Biogal, for putting this webinar on. Thank you to our translators for all their translation. And to everyone who's logged on and joined in, thank you for your time and for your questions. It's been great having you join us for today's webinar. There will be more coming up in future, along with the exciting tips on business, which we learned about with a short video clip at the end there. So keep an eye out for those, and we hope to see you again soon. So thank you to everyone. Enjoy the rest of your day, and we will see you again soon. Bye-bye.
Bye-bye.